The U.S. Department of Health and Human Services has opened a division inside the Office for Civil Rights called Conscience and Religious Freedom. Now, this is a move that happened over the last week with the rationale that it's going to help enforce the laws protecting religious freedom. They said that there are too many doctors and nurses and healthcare professionals that aren't able to express their religious freedom, instead putting their priority on patients instead of religion, and they thought it should be maybe the other way around. This new office inside the Office for Civil Rights, they say, will allow doctors, nurses, and other healthcare professionals to decline to participate in care that goes against their own personal moral or religious belief. The HHS website has been updated, and it gives a couple examples. We'll share that web link with you so you can visit it for yourself, such as if a patient wanted an abortion, assisted suicide, sterilization, etc., the doctor or nurse could decline to participate. Now, this is not the first time we've seen this coming out of the Trump administration. This comes after the administration made changes to the Affordable Care Act birth control mandate. This was a May executive order with regulations published in October and made effective immediately at that time. As you might remember, the Affordable Care Act required employer-sponsored insurance plans to cover prescribed contraceptives. The new rule coming out of that executive order out of the Trump administration rolled back those federal requirements that an employer must include birth control in that plan. It gave exemptions to any employer that objected on the grounds of religious or moral belief. And we're seeing that language repeated once again in this new division of conscience and religious freedom. Now, the new office comes with some new guidance saying that they can deny services to marginalized disparity patients. They're getting a lot of criticism for this, as you can imagine, from medical groups, women's advocacy organizations, LGBT rights groups, all agreeing that vulnerable populations will get unequal health care. And they take it to another degree, thinking about populations that could suffer the most, thinking about transgender patients, immigrant patients, or patients of different religious backgrounds. It could be a quite broad impact on populations as they're seeking health care. It opens the door to discrimination, is what some of these advocacy organizations and opponents of this new division are saying. And the impact overall could be denied or delayed care. And you think about the oath that doctors and nurses and healthcare professionals take to do no harm, but first to do a duty to their patient. This new office is reversing that duty and letting the duty to the doctor or nurse come first to their own belief before the duty to the patient. It is quite the controversy and quite the moral question. Maybe you have your own beliefs and feelings about this new office inside the Office of Civil Rights. We'd like to hear what your take is. You can send us an email. You can visit us at healthwatchwisconsin.org. We also make available where you can visit the new HHS office website for yourself. You can also read the HHS press release that talks about this new office and gives some examples of types of services that can be denied. Thanks for watching.